The Endocrine System by Addisen Mayne. The parts of the endocrine system are the pituitary gland, the hypothalamus, pineal gland, thyroid gland, parathyroid glands, the thalamus glands, the adrenal gland, the pancreas, the testes in males and ovaries in females. The endocrine system is the collection of glands that produce hormones that regulate metabolism, growth, development, tissue function, sexual function, reproduction, sleep, mood, and many other things. The pituitary gland and hypothalamus work together to influence hormone production in other glands. The pituitary gland is suspended in the hypothalamus, which has a large anterior lobe and a small posterior lobe. The thyroid gland lies just beneath the thyroid cartilage. This gland secretes two hormones called T3 and T4, which stimulate tissues to produce proteins, increases the amount of oxygen a cell uses, and controls the metabolic rate. There are four parathyroid glands, which secrete parathyroid hormones. The thymus gland is located in the mediastinum and secretes a group of hormones that help stimulate T lipocytes. The adrenal gland sits on top of both kidneys. These glands produce more than 25 steroid hormones. The pancreas is located behind the stomach. It secretes digestive juices and hormones such as insulin and glucagon. The pineal gland is found deep inside the brain and helps to regulate circadian rhythm and reproductive hormones. The testes and ovaries both produce reproductive hormones. The testes produce sperm and testosterone, while the ovaries produce ovum, estrogen, and progesterone. An endocrine disorder, adrenal insufficiency, also known as Addison's disease. Addison's disease was discovered by Thomas Addison in 1849. The disease occurs when the adrenal gland cannot make enough hormones, cortisol or aldosterone. There are many symptoms, but the main ones are darkening of the skin, low blood pressure or fainting, craving salt, hypoglycemia, body hair loss, and sexual dysfunction in females. To be diagnosed, only about 1 out of 100,000 people have Addison's disease in the United States. Males and females can both get this disease, usually between 30 and 50 years old. To get a diagnostic test, you can have a blood test measure for sodium, potassium, cortisol, and ACTH. ACTH simulation test measures the levels of cortisol in the blood before and after injections of synthetic ACTH. Insulin-induced hypoglycemia test checks blood levels after injecting insulin at various times. And there's also imaging tests, such as CAT scan or MRIs, to view the size of the adrenal glands. Treatment for Addison's disease. Addison's disease is a chronic illness with no permanent cure. The disease can be life-threatening. To manage the symptoms, patients will use oral or injections of corticosteroids. If the onset of the disease is sudden, patients will receive hydrocortisone, saline solution, or dextrose.